Hi, I'm Ford Gilbert, and a lot of people ask, if the artificial pancreas treatment is so good, why haven't I heard about it before? Well, the answer is pretty complicated, but I'm going to try to get it into a nutshell. Diabetes is a disease of many, many facets. Virtually everything about a body is going wrong. So when you are studying something that affects diabetes, it's not like oncology where you're just studying about cancer, or orthopedic surgery where you're just studying about bone growth and that sort of thing. With diabetes, you study everything. And unfortunately, because it's a very slow progressing disease, even though it's a horrible disease, it doesn't come on overnight. So any studies that you have in reference to diabetes have to be fairly long term. Most people don't know that medicine is not fast because they think, well, if something works, it's going to be there in a minute. But that's just not the way it works. We had to go through, of course, the FDA. We've had to do our clinical trials. We've had almost 20 publications now. All of those take a huge amount of time. But the thing that took us the longest was to make it so it was replicable. By that I mean, if we had to go out and train a physician to do this therapy, and we had to train every physician who was going to deliver this therapy, and we had to train them individually or serially, then it would take forever. So what we had to do was not only get the regulatory approvals, the FDA, we had to get our insurance reimbursement aspects taken care of by very elegant clinical trials, which have always been in prestigious institutions like the universities in the United States. But we also had to make it so that if any patient came in, that patient would be easily and properly treated, the same in Minneapolis as in Miami, or in Arizona as in New York. And we've been able to accomplish that now, but it took us a long time. So the bottom line for this is that the average concept to implementation of a new therapy is roughly 30 years, and we're well ahead of that because we have actually only started treating type 2s about 18 years ago. So, and type 1's about 24 years ago. So the bottom line is we're ahead of the graph, and it is as good as we say it is. And the fact you don't know about it doesn't really make it invalid. You should find out about it. Mostly you should talk to our patients. There's one final thing that's kind of funny, and I don't know how to explain it any better than this. Diabetes is often associated with endocrinologists, and they are the most interesting type of diabetic physician we can encounter. The average endocrinologist has a great love of studying. So when you talk to an endocrinologist, they want to know everything that there is about the pathways that we affect. In other words, it's not enough for the average endocrinologist that it works, they need to know why it works. I don't disagree with that. I think it's valid that every scientific inquiry that should be made is made. We, on many occasions, have presented to endocrinologists, and they want more and more and more studies. And at a point in time, it got to the point of, okay, we've got all these studies, we have all these patients who are doing very well, and so what are we going to do? Study them more, or make it so that it's replicable and go out and get people signed up and actually treated? We opted for the latter. So we have not really gone after the endocrinologist as a body to explain to them everything they need to know. It may be that we'll never be able to do that because some of the things that happen with this treatment are very surprising. But they're all very consistent with good health. And so while many endocrinologists have of course joined our ranks, the average endo won't know about us. And if the fastest thing that you'll ever hear from an endocrinologist is, if they don't know about it, it can't be real. Fortunately, we've been able to take endocrinologists who have taken the time to study us, and virtually all of them are in agreement now. I don't remember an endocrinologist who thought that we were not valid, or that our patient outcomes weren't correct, or that there was something wrong with the methodology that we were taking, or something like that. You see, it's very hard to argue with replicating the way that man is made, because that's the beauty and that's the power of this treatment. What we're doing is we are perfectly mimicking the signal that a normal pancreas gives to a liver and other tissue. So how is a physician or a scientist going to argue that that's not a good thing to do as long as the outcomes are as good as they are. So in many respects, endocrinologists are a little bit more technical than they need to be if they wanted to be, but I'm not trying to give them a hard time because goodness knows we enjoy every scientific inquiry. But they're probably the hardest ones to convince. But once you convince them, they're fine. And the best way to convince an endo is to take one of his really train wreck patients. And that's something else about this therapy. This therapy works on the most severely impacted patients. This therapy works on the train wrecks of diabetes. And so we don't cherry pick or just take the ones who could get better on their own. We actually treat the worst of the worst, and we've been very, very successful. So by taking a patient from an endocrinologist who he feels is a total failure and he's tried everything in the book for him and he can't get anywhere with them, and then when we remedy that patient's problem, which we generally will do in a matter of months, that's when the endocrinologists really enjoy us. But to make it simple, to make it really simple, this is a simple answer to a complicated thing. This is a simple answer in the sense that we just do what God does when God made man the normal way. And so we are replicating a normal pancreas, and that's a simple answer. And endocrinology is a study of very complex pathways. I'll tell you, there are thousands of proteins in the body. We still don't even know what they do. So if you are going to look at science objectively, the scientific world is proper to ask these questions. But while we're asking these questions, we really enjoy treating people because they get better and because we have never had an adverse reaction. And I've often thought about just saying, what does that mean in medicine? When you watch a television show and it says, take this drug, but if you have this, and this, discontinue and call your doctor right away. Well, we haven't had any of those. So we don't know what to warn our patients about, except, of course, obviously watching their blood sugar to make sure they don't become hypoglycemic. So the very few things that we have to watch for when we normalize a patient are easily monitored. And frankly, as you can find out with the FDA, we've never had an adverse reaction, which is rather interesting. We've never had a recall. We've never had anything that needed to be explained, if you will. So that's the long answer to a very short question. Why haven't you heard about it? Because it takes a lot to do what we do, and you have to set up a whole clinic. It's not like you just give somebody a pill. I mean, if this thing worked on a pill, you would have the pill already, number one. And number two, you wouldn't have to set up a clinic to do it. But in order to replicate the way in which a pancreas tells the body to burn carbohydrates, you actually need a clinic. And putting up clinics takes time and money and effort and that sort of thing. So hopefully within the time that you've heard this long answer to a short question, another clinic will be near you, because as you probably know, we're opening up clinics all over the world. So thank you very much, and my heart and soul still goes off to the endos, and I want them to be happy, but in the meantime, we're going to treat and help a lot of patients. Thank you.